The trochanter, which is at the hip, it's this little bump on the outer part of the hip. We use that also as a landmark for finding IM injections, especially those on a child. A tuberosity is another one that you heard Kathleen McDonald Dabney, the physical therapist, talk about when she spoke with the class. The ischial tuberosity, you feel that when you sit down, that's the part that hurts a little bit. And then a foramen is a round opening. I think of the magnum foramen, which is the big round opening at the base of the skull where the spinal cord and the brainstem meet. So, and we'll talk more about that coming up. The skeleton that you see on page 117, get to know that. You need to know where all the bones are located. So that would be a good thing to work on. And I gave you ideas on how to learn that on Moodle, which have a family member lie down on a old paper tablecloth if you have one and outline them and then try and draw in the bones. Page 118 also talks about the bones of the skeletal system and gives you an idea of how to learn them a little bit better. And also the life lesson talks about examining skeletal remains and how that is done. So it's kind of cool information. After that, it gets into the different parts of the skeleton itself. We start at the head and we work our way down. If you look on page 119, it talks about the cranium. Take note of the body at work at the bottom, knowing what the sella turcica is, which is kind of cool. That's where the pituitary gland gets to sit in the head. And also the discussion about the cribriform plate. The cribriform plate is kind of interesting because if you have an upward blow, it can push that cribriform plate up and bony fragments can go into the brain. Then you have cerebral spinal fluid leaking out the nose and can lead to severe infection of the brain and ultimately possible death. So that's an interesting discussion. On page 120, it talks more about the suture lines, and then at the bottom, there's that foramen magnum that I just talked about. That life lesson there at the bottom of 120, it talks about if you have a blow to the head, the top of the head, it can force the brainstem down through that foramen magnum, which will cause trauma, and that constriction of that bone will not allow the brainstem to get adequate blood flow, and it will cause respiratory arrest and death. So a blow to the top of the head is not a good thing to have. Page 121 shows you the facial bones, so learn those. Some other specific things that I wanted you to think about with special bones. Take note of on page 122, the hyoid bone. Knowing if that's fractured, that's usually a sign for people to know in autopsy that that person may have been strangulated. Some other common things to know would be the most common bone broken is the clavicle. Get to know the vertebral characteristics and what causes a herniated disc and how that is fixed. Know what your abnormal spinal curvatures are: scoliosis, kyphosis, lordosis. I think scoliosis is easy because it's an S-shaped. Scoliosis begins with an S. Kyphosis is the hunchback. Lordosis is the lumbar spine. Has the curvature, and lordosis and lumbar both begin with L. That's a nice way of remembering it. The other thing on page 125 is the special characteristics of the vertebral column and the vertebrae. Knowing specifically the first two, the atlas and the axis on 126, because they look a little different than the rest. And you can see the atlas is more flat shaped. It allows for the head to move back and forth when nodding yes. The axis has this little dens, this little projection up that allows the head to swivel from side to side when saying no. And then the rest of it is just learning the bones one by one. So take note of the pelvis. What is the true pelvis? What is the false pelvis? The difference between genders of male and female. and take it clear down to the toes. And it's basic memorization. So I would do your workbook. I would use your online resources. There's flashcards. Do whatever you can to learn them, because you need to know where your bones are. And you need to know what the bones do. I hope this video helped. Thank you.